Since 1988, Save the Children Australia has been making a difference in the Lao People's Democratic Republic. Of the country's 6 million people, 40% live below the poverty line, and more than half of the population is made up of children and young people. The high infant mortality rate and low life expectancy are just two of the health indicators which present a number of challenges. Save the Children Australia was one of the first international non-governmental organisations to work in Laos. Over the years, we have implemented major initiatives in child and youth protection and participation, education and training, anti-human trafficking, HIV and AIDS, primary healthcare, and rural livelihood development. Save the Children Australia has taken a holistic approach to improving healthcare in Laos. We not only focus on health issues, but aim to improve services at hospitals and health centres and build the capacity of local health service providers. Save the Children Australia also supports mobile health outreach services and health promotion to remote communities. Established in 1992, the Sayaburi Healthcare Project has achieved impressive results, with health statistics for Sayaburi Province significantly better than for the rest of the country. However, at the start, there was a lot that needed to be done.
Well, my job description was to improve maternal and child health services, but it became fairly obvious after being here for a few weeks that, that more was needed because the health services are really rudimentary.
Save the Children partnered with the Lao government to implement the primary healthcare project, as well as developing the skills of clinic and hospital-based staff. Save the Children Australia has trained birth attendants who travel into communities. The health focus is on prevention rather than cure, with healthcare workers and volunteers taking treatment and education to people in outlying areas.
Train all the staff in Snyangri, and we train all the representative of the village come to be a volunteer health worker. After that, then they know how they do this and go to village and make the education. They know how to save life.
Now, 30 to 40 patients visit the hospital each day. The results speak for themselves. With improved maternal and child health care in Sayaburi, mothers are about 5 times more likely to survive childbirth. People generally are likely to live 15 years longer than the rest of the country. The successful Sayaburi Healthcare Project has been expanded into neighbouring Luang Prabang province, and indications suggest the program will have a similar impact on health in the area. As education spreads and attitudes change, the faster the health transformation is likely to occur. Also, Save the Children Australia has initiated poverty reduction projects to help develop rural communities. Microfinance is usually in the form of a loan to an individual. With a small loan, the borrower can buy tools, land, or pay for services to help generate an income and repay the loan. Mr. Tongsit bought some land to grow maize, as well as school uniforms for his children. Mrs. Vanna doesn't have a large family, so she used her loan to hire labour to help cultivate her rice field. Women form the largest percentage of the world's poor. Recognising this, Save the Children Australia provides specialist training to women in Laos to establish small livelihood activities. The women are offered credit to start their activity and generate their own income. Sive Sayalat became a fish farmer, and Buachan Tamalat teaches other women traditional embroidery skills so that they can sell their garments at local markets. More than 80% of the women borrowers feel the loans have improved their livelihoods. Save the Children Australia also works with children and young people. Lao youth are perhaps more vulnerable than many. Acute poverty and a lack of educational opportunities and services in rural areas mean young people may have little or no opportunities to realise their potential. This can lead to unsafe migration and drug and alcohol abuse. It also puts them at risk of human trafficking, labour exploitation, unsafe working conditions, and HIV and AIDS. Save the Children Australia has established safe places for children and young people to go after school. At child and youth development centres, youngsters can participate in fun activities and training and learn life skills to make informed decisions to protect themselves. In 2004, Save the Children Australia established a preschool in Paktang village, Sayaburi province. Before the preschool opened, villagers had to take their children to the field while they worked. Thanks to the preschool, parents can now focus on their work while their children learn and play safely at preschool. Encouraged by what has been accomplished in the last 20 years, Save the Children Australia is looking forward to supporting the people of Laos to achieve even greater results in the years to come.